Today I'm going to be showing you how to insert an indwelling catheter. First, I would start by placing clean gloves on my hands. I would adjust the bed to a comfortable height, and I'm going to provide pericare to my client to remove any kind of bacteria or microorganisms that could just be laying down there. So after that, I'm going to remove those gloves. I'm going to make sure my client has their legs spread apart. Try to keep the patient as relaxed as possible. And then at this point, I want to remove any kind of watches or jewelry that I may have on. And pull my hair back so that it's not hanging over the client, or a jacket if I haven't said that. Then you're going to set up your sterile field. All right. So I'm going to start. I'm going to have 1 inch around the edges to work with. So I'm going to make sure that I maintain that 1 inch border of sterility. So I'm going to remove the gloves provided, and I don't want to touch anything else inside. All right. And then I'm going to put on sterile gloves. So all right. Okay, now my hands need to remain above my waist so I can go ahead and start working with everything in here. So first things first, I want the shiny side down. Take the corners of my thumbs and roll in. And I'm gonna place that, set it and forget it. That's to catch any kind of any fluid that may come out or anything, just to keep the area down there as dry as possible. And I'm gonna place this. All right. Okay, so I want to get my sticks, open those. I don't want to cross the sterile field. And then I'm going to get my lubricant. Put it in the tray. Throw it away. And then I'm going to take my saline, the cap, throw it away. And then I'm going to go ahead and connect the saline. The cap for the saline is the saline is to inflate the balloon inside the bladder. So we want to go ahead and connect that. And then we're going to remove this from the sheath that it's placed in. Discard that. And then I'm going to place this in the lubricant tray that's in the tray. Okay, now once that's set up, I'm going to then swab the area and clean it. So for a male, I would start at the meatus and go around with one swipe on each Q-tip, and then go around again and around again with 3 Q-tips, but further and further away from the meatus. For a female, once I use this hand to spread the labial folds, I'm not going to be able to use this hand again. So what I'm going to do is go ahead and use this hand, commit it, spread the labial folds. I'm going to do one swipe furthest away from me, toss, second swipe closest to me, toss, and then I'm going to do the third swipe down the middle. And like I said, to clean away any bacteria, it's going to be iodine swabs. So once that portion's done, I'm ready to insert my catheter. So I want to make sure it's lubed up, and this can drag across my sterile field, that's okay. I'm going to insert it in the urethra 2 to 3 inches until I see urine return, which means it's in the bladder, and then I'm going to insert 2 to 3 more inches. I'm sorry. Insert 2 to 3 inches and then insert another 1 to 2 inches. Once it's in and I see the urine return, which means it's in the bladder, I'm going to hold on to the tubing, and then I'm going to grab a hold of the syringe, and I'm going to insert the water or the saline solution to inflate the balloon. And I want to keep note of how much saline solution I am using for documentation purposes later. So once that saline is inside, I'm going to tug gently, and you'll see that the tubing is inserted. It's not going anywhere because that balloon is inflated in the bladder. And now this is no longer a sterile field once that's inserted. So I am going to then clean up my mess. I'm going to stat lock the catheter to the leg, and let's see. I'm going to stat lock the catheter tubing to the leg, and I want to provide some kind of a little bit, make sure it's a little loose, so you're not tugging on that area down there. And then I'm going to place the catheter on an immovable portion of the bed. I don't want the bag to ever come above the patient, because you don't want to have the urine flow back into them. So you would place this on a immovable part of the bed. Then you would clean the area, lower the bed to the lowest position, provide the call light, and after that, you would make sure you do your documentation. You want to document the French size as well as how much saline you used to insert the catheter for the balloon. Okay, and so now I'm going to show you how to discontinue a catheter. So all this would be gone for the purposes of the video, and just in case I have to do this a second time, I'm just going to leave this here. So what you would do is you would have your bag ready. You would get your catheter, you would empty out any of its contents, make sure that you're checking the clarity, the quantity, recording that, and all the information down in the computer that you need as far as that. And you want to make sure when you're doing that documentation, you also check to see how much saline was used for the balloon when it was inserted into the bladder. So once that's done and this is emptied out and your documentation has been recorded, urine discarded, and obviously you have gloves on during that process, we're ready to discontinue the discontinue the catheter. So I would drain the bag, obviously, empty all the contents of urine out of the tubing. Then I would place some adhesive remover on the stat lock because it would be very painful without the adhesive remover. Okay, and then I would take my syringe and empty out the saline solution. What you may notice is that once that balloon is starting to get deflated, it will naturally come out on its own. But you want to really make sure that you get all of that fluid out, and there's a negative pressure on that just to make sure that you're not hurting them. And if you've got to do it a second time where you suck out more water just to make sure you've got it all, do that because you don't want to hurt the client. So then I am going to discard that saline, and then I'm ready to it should just slide right on out. And then I can discard all of this, discard the catheter, but I want to note if there's any breakages or anything that could have been left remaining in the patient. I do want to check the tubing on that. So then, once that's complete, you are going to, all this should be up already. Once that's complete, you're going to provide pericare to the client. You're going to cover them. You're going to educate them on making sure that they use their call light in the event that they need to urinate. That way we can see if there's anything wrong with the urine as far as the color, and we want to make sure that they're back voiding on their own to just have that normal bladder functioning return. You're going to lower the bed into the lowest position. Place the call light within reach, and then ask the patient if they need anything. Obviously, I'm not going to have gloves on at this point. I am going to go to the computer. I'm going to document the amount that the catheter was discontinued. I'm going to document any abnormal findings as far as the catheter, and notify the doctor if any pieces have been stuck or remaining or broken of the catheter. And I'm also going to document, if I hadn't already, the other information as far as the urine, how much saline and that was removed, and information as well as that. So thank you.